Good evening to our viewers and welcome to this special show dedicated to caring for cancer patients during COVID 19. I am Kamal Narayan, CEO of ISW Council, a social impact institution for health awareness and behavioral change. It is perceived that caring for people with cancer needs specialized training, especially in terms of administering medicine and reducing pain. Therefore, a hospital is always a preferred choice to allow access to the best care. However, this pandemic has changed it all. The fear of catching the coronavirus infection is making many prefer to resort to home care over going to hospitals. And sadly, in certain cases, many are avoiding hospitals even in case of emergencies. This is despite the fact that the temporary disruption on the healthcare services during the initial phases of lockdown is over and most of the healthcare services are back to normalcy. Home care of cancer patients, a trend catching up for quite some time now, has become a necessary part of life for affected people and their families. This is also important from the view of reducing excess load on hospitals and to ensure more comfortable settings for patients going through a long term care. But how do they cope up with the perception of home care being a lesser alternative? How did they manage the more complex tasks such as setting up an IV fluid sachet or administering oral chemotherapy drugs? And what is the best way to ensure this under the best possible medical supervision? To discuss these aspects and to let us understand more about home care management for cancer patients, today we have with us an expert who needs no introduction. Let me welcome Dr. Suresh Advani. Padma Bhushan Dr. Advani is a renowned medical oncologist and one of the best in India. He was Chief of Medical Oncology at Tata Memorial Hospital and also set up the Oncology Department at Jaslok Hospital, Mumbai, where he is currently the Chief Medical and Pediatric Oncologist and Hemato-Oncologist. Dr. Advani has been a practicing oncologist for more than 4 decades now, but more than his medical caliber, Dr. Advani is a story of grit, passion, and unending hope. He contracted polio at the age of 8, which made him wheelchair bound for life. And despite all odds, Dr. Advani had a stellar academic performance and got a rare chance to work with Nobel laureate Dr. E. Donald Thomas, known as the father of bone marrow transplantation, and became the first oncologist in India to successfully conduct a bone marrow transplant surgery. So here we are going to discuss with Dr. Advani about the home care for cancer patients and also going to understand that how the cancer landscape has changed in our country. However, before I begin our conversation, I would request our online viewers today to keep sending their questions on the comment box, and we will be trying to answer most of them in the next 40 minutes. Also, like and comment with your feedback, and do share this special show on your wall to help many others who may get benefited with this information. So, let me begin with Dr. Advani. Dr. Advani, you have been pioneer of cancer care in our country, and you have seen that how some of the cancers which have become highly preventable now, many of them have become very curable now. How do you see the overall changing landscape of cancer during your 4 decades of experience as an oncologist?
Yeah, I think the cancer, understanding of the cancer and its management has undergone rapid revolution. And these are the revolution, evolution, whatever you call it. But it has evolved into a field which is too extensive now. And it has changed for the best because today we are able to understand the cancer in a better way. We are able to understand the biology of the disease both at the cellular level as well as at molecular level. And also, the fact remains that our strategies have also changed. The most important thing that has happened is that previously, maybe 40 years ago, how the treatment used to develop. It used to develop by serendipity. That means somebody notices something and then the drug will come out. And it will take 10 years for next drug to come. Today, the whole evolution of the new therapeutics is coming up because of the basic biological knowledge. And therefore, we know the target which we have to attack, and based on that, we have a therapeutics. So, in other words, today therapeutics is engineered therapeutics. You are engineering the therapeutics, and therefore, almost every month, new and new therapeutics are developing and helping the patients to one to get the better results and at the same time the less toxicity. So I think there has been tremendous change, as you mentioned, that many diseases, like I remember acute lymphoblastic leukemia, one of the leukemia which is common in the children. In 1974, there were hardly any 1% or 2% survivals. Today, 80% of these children can hope to live a normal life. So look at the leukemia, which is quite often people are afraid of. But today, the acute lymphoblastic leukemia in children is the most curable disease. So that type of a transformation has happened, and therefore I feel that today we are really doing the wonderful work in the sense that among all the malignancy, 50% of them are getting cured, which was very less than 10% 30, 40 years ago. So I think that's a change that we have seen.
That's a really a wonderful development which has happened both from the medical side and also from the skill side of experts like you who are able to kind of bring in better intervention. uh, as you said, sir, we have seen that a lot of cancer have become much more curable, preventable, but at the same time we have seen a very rapid maybe exponential growth of cancer cases in our country. The recent ICMR study says that we are going to see around 12% growth. They are expecting around 15 lakh or so cases coming next year. How do you see this massive number of growth? What are the causes to on which this can be attributed to? And is this the right the actual number, or we may be having so many other cases which are still not getting or reaching to the hospitals or to the experts at the right time?
I think there's no question that over a period of time, the number of cancer patients are rapidly increasing. Actually, it is a true rise. It's not just the more numbers are being diagnosed. It's an actual rise. We have seen like carcinoma of breast in last 10 years. Every year it is increasing by 2%, which is a very big number. Today in USA, 1 out of 8 ladies suffer from breast cancer. And in Bombay, 1 out of 28 ladies is going to suffer from the breast cancer. So that's a huge number. And if we follow, or our population follow the population of USA in terms of habits and everything that they have acquired, I think soon in Bombay also, we will have 1 out of 8 ladies suffering from the breast cancer. What I wanted to say is that over a period of time, 30, 40 years, the numbers have rapidly increased, both because of one, the population, which is becoming more, and the population is also the particularly elderly population is increasing. And in elderly, the cancer is more. That is known very well. So I think that's why we are seeing more and more number of patients. So actual rise plus because of the shifting age of our population, we are seeing more and more cancer patients. So I think what ICMR has predicted is really true. And I think we are still lagging behind in terms of the facilities. Maybe facilities are very good at the level of big cities, but if you go out of the city, uh, whole approach is absolutely different.
So I think it can be said that while the cancer is becoming kind of universal, the cancer care is not universally available in our country, and mostly all the rural areas are definitely out of this
Yeah,
purview.
I think cancer care, good cancer care, I'm not talking about cancer care. The good cancer care is available only in the big cities. Smaller cities, good cancer care even today is not possible, particularly in some province of the countries where it's really rudimentary, I would say. You go to the northeast, you go to the some parts of Bihar, some part of UP. It's really very difficult for them to give the good care to the patient.
And that's the reason I think the most of the people have to either go to city like Delhi or Mumbai, at places like Memorial Cancer Hospital, which you have been heading, the oncology department. So let us come to the since you have mentioned two things. One is that very aptly about breast cancer prevalence, and we are approaching towards the month of October, which is kind of observed as a breast cancer awareness month across the world. And we are, as a just to mention that from ISW Council also, we are planning to take up a massive month-long awareness drive during that time, again to educate more people to kind of do timely screening, and also go for the more preventive aspects of such cancer, which is kind of crippling or going to cripple our population over the period. So we'll look forward, Dr. Advani, your support also on that, to spread more awareness on women or breast cancer related things. So our today's discussion is about how home care has become a kind of new normal. Many time, because that's a wise thing to do, because you are kind of having a very concrete possibilities of getting infected of COVID-19. Uh, People do need to be taking all the precautions. So how do you see that this whole home care requirement emerging for cancer care, and how much it is practical to provide effective home care for cancer patients?
Yeah, I think before we talk about home care, we have to understand what is the COVID-19 doing to us, in general. All of us, including you and me, we are taking extra care to prevent the COVID-19. And how do we take care? By just following the WHO guidelines that stay at home unless essential, keep a safe distance, hand wash the hands, and the putting on the mask or elbow cuff so that you are not spreading the disease. So I think these are the things which all of us, all today, everybody knows that these care has to be taken, and then only you can prevent or ultimately take care from the COVID-19. Now, in this situation, everybody also knows that those who are sick, like if you have a cardiac problem, you have a respiratory problem, you are you are a patient with a kidney disease, or for that matter, even cancer, you are liable to severe toxicity because of the COVID-19. In other words, if a normal population COVID-19 occurs, majority of them will recover very little small mortality. But mortality may be more in people who have any of these diseases. And that's why everybody is taking extra care for this special group of the patients. Special group may not be patient, but it's a special group. Elderly people at the age of 80, they have a high mortality if they get the COVID 19. So I think elderly group, people with the lung problem, people with the heart problem, they are trying to remain at home, stay home, which is a basic thing, and unless essential, they don't move out at all. Now the question comes: the majority of the cancer patients are in that group. Look at it. I mean, the cancer is breast cancer, many lung cancer, all the cancers are common between the age group of 50 to 80. And probably 60 to 70 is the maximum. So these are the patients who have to take the treatment. Treatment is surgery, that's okay, one time affair. Then radiotherapy, which may go on every now and then, and the chemotherapy. And chemotherapy is most of the time recurrent. That means you take every 2 weeks, 3 weeks, go to the hospital, take some drips and all, take the chemotherapy, come back. So that is the main thing with respect to the uh, this uh, chemotherapy. So obviously people don't want to go to the hospital because they feel that in the hospital setup, where also the COVID-19 patients and their relatives are coming, they may be exposed to that. So there's a high chance of exposure as compared to the normal public places. And that's why patients are a little bit afraid. I must say, majority of the, even the children, they come and tell us, I don't want my mother and father to come to the hospital. The patient also says, everybody else around them, they say, no, we cannot allow them to come down of the flat or come down to the hospital or go out. And that's where I feel that everybody has realized that what is the home care. And that's why I think today's topic, that the home care has come in relation to the COVID-19, particularly because people want to stay safe, stay at home, keep the distances, and keep the away from the patients and the so-called asymptomatic carrier. So that's the whole purpose why the home care has been in demand in such a situation.
Thank you so much, Dr. Advani. So definitely, as you are, rightly highlighting that since the cancer cases are more at the advanced age, and COVID-19, not only cancer cases, but other, diseases, heart diseases, diabetes, hypertension, they're all in that is they are in a high prevalence, and they are more susceptible to COVID-19 infection also. So it has become a kind of necessity for people in this age group to try to be at home and avoid any kind of exposure. But Dr. Advani, let's say if I'm a cancer patient, and so is it possible for my family members who are not medically kind of trained to provide me adequate care, which normally is done by a trained medical professional, or is there a different kind of cancer care is available at home also, or my family member need to go for some special kind of, let's say, training to make it happen?
Yeah, I think people think that we will change the treatment because the COVID-19 has come. I think that's not possible. The treatment is the best of the treatment known, and you cannot give inferior treatment just because COVID-19. So you have to keep up with the most advantageous treatment. So I don't think that COVID-19 has any impact in our mind. As a physician, we are sure that we want to give the best of the treatment to our patient. No way we should compromise. And I think over a period of time, everybody has realized that it is possible to give the same type of treatment as otherwise without the before the era of COVID-19. So with that sort of impression in our mind, we have to, with all these limitations, we have to make sure that everybody receives the best treatment. Of course, the problem comes not because of the few of the things which I told you, but also because the all the medical facilities all over India, they are more occupied today by the COVID-19. Majority of the hospitals, they are occupied, and therefore there's a very little space available. I'm not talking about only the space, but space means you have to have the space, you have to have the infrastructure, you have to have the human infrastructure, the nurses, doctors, and the all like ventilators. You have to do the surgery, you have to have the ventilators over there. So all these things have become limited, and therefore, if I have to treat a patient, I feel that patient may need ventilator, I can be in doubtful that at that particular moment when it's necessary, we may not get the space in the hospital. Now, previously, that was not so. Space was available. So we were confident that even at midnight, we will get the care in the hospital. Today, in some places, not in all places, that is a big doubt. And therefore, people are compromising on the treatment.
So, still, sir, in terms of again that since the space and that is your human infrastructure also, the healthcare professionals are not available in that kind of numbers, in that kind of magnitude. So when it comes to home based care, and especially for something like cancer, where you definitely require a much more specialization in terms of, or specialization, or a little bit of more specific maybe training. So how do you bridge that gap? So let's say if your bunch of patients, how are you making them stay at home and at the same time keep getting the care which they need? Uh, uh,
Yeah, no, I think this is very important. We have discussed among ourselves and discussed with the expert outside also that how they are managing. And the one thing is very clear that the treatment has to be not inferior, whether it's a home or hospital. It has to be exactly the same. And therefore, how do you manage that? Some of the treatments are, we know that they are associated with high risk, which means that the patient may get bad during the treatment, he may need ICU, and he may get some allergic reactions. So those things are identified. And these, once you identify them, they are excluded from the home care. You cannot treat a patient at home when there is a chance of getting the need of ICU. So from our experience, we can make it out that no, we cannot take that risk. The second thing is we allow the home care, encourage the home care to be taken at home in those patients who need the treatment which is absolutely non-toxic. And the third, which is I think is a more important thing, is that the first dose of the treatment is always given in the hospital, so that you are sure that nothing happens to the patient. And in the first course, if nothing happens, it's absolutely unlikely that in subsequent treatment anything will happen at home. So if you take care of these things, that you select the patient, give the non-toxic treatment at home with the first experience at hospital, I think you can successfully deliver. One thing more which has happened is we always bother, I get bothered also that how legally we are safe in this era. How much is the legal protection to us? I think recently only the online advice has been now cleared by MCI. That means on online I can advise the patient. Previously that was not legal. We were doing it, but that was on our own. Today, online prescription is valid, even if it is my signature not there. My name is there, it's valid. So you can see that legally things are also changing. And I'm sure for the home care, the legal things will also change. They've already changed in Australia. In Australia, the government realized that they cannot have so many hospitals to give the daycare chemotherapy in hospital. So they have opened up the whole thing for the home care companies. So today in Australia, government hospitals give the home care companies the contact that you look after my patients at home and you will be paid so much. You will, that is also approved for the insurance purpose. So look at that, how legally people are changing. And I'm sure India will not lag behind. India will also change. The government will also change. They will also allow all these things to be legally.
Acceptable. Yeah, so definitely this is an important aspect, because I think COVID-19 is making so many things change, and that I think online medical prescription is one such thing which we have seen, and I'm sure that it is going to continue, because it can definitely bridge a lot of that demand and supply gap when it comes to at least the doctors in our country. Uh, Dr. Advani, you said about that there are different three type of patients almost, and there where you need a very kind intense care, and they have to go to hospital, and definitely there is no way to keep them at home. Then there are a type of patients who are going to get into the first round of medication, and which has to happen in hospital, and then all follow up patients can be taken care of in home care management. But during the pandemic time, it has also been kind of seen, as you also mentioned, that even the children don't want to take the patients or the their elderly to hospital, uh, just because there is a kind of a fear of COVID-19 as well. So do you see that this is happening, where the need is actually there for getting a patient to the hospital, still it is being delayed or avoided, and is it leading to some kind of extra maybe burden of cancer progression or maybe mortality also? How do you see as a veteran
No,
this?
I'm telling you, I have seen tremendous impact. Uh, Recently, only I think about 6 weeks ago, one of my patient is 82-year-old, and his daughter is young, and she wants to see that he receives a treatment of multiple myeloma. This is quite a simple IV drip. So first time we admitted him, we gave him the treatment at home, and then she said, "Oh, I will stop the treatment." I say, "What happened?" He says, "In the hospital, what I saw was not acceptable. There were so many COVID patients, their relatives, they're walking around, moving around. We are also going to the hospital, not only one person, but three, four people, because my father is elderly, and we are afraid. We are also afraid that we may contact the COVID-19. So I will stop the treatment." I said, "You should not stop the treatment, because the treatment is so effective. If it was not effective treatment, I would have said, okay, but here the treatment is very effective. he will be soon able to walk and move, and we will help you to take it at home. And we talk to the home care, and they arrange for him everything. What is the main thing that home care do? Is that they have a trained personnel. So it's a nurse who is trained, very much trained for the chemotherapy, and along with they can keep in touch with the doctor who is also experienced all the time. And the most important thing is they take care. Take care of what? I think two things. They take care that they should not transmit anything to the patient and the relatives. That's also very important. At the same time, also being the health professional, I want these people who are health professionals providing the home care should not also uh, get the COVID-19. So both way the care has to be good. So all these home care companies, particularly for the COVID, now they are advising, they have taught these nursing staff how to make sure that both way patient is safe, relatives are safe, and the health professional is also safe. And that's why wear mask, the PPE, and other gloves, and all these things are making a big impact.
So safety is one most critical and important thing, I think, which has to be taken care of in, I think, the best possible manner. Uh, Dr. Advani, when so as you said that there are healthcare home-based healthcare providers, and they are taking all possible precautions. They are training their resources so that it is possible to ensure that effective and safe care is provided to the needy patients. From a patient's point of view, or from patient's point of view, what are the things which you suggest we should keep in mind when we are roping in home care service for cancer patients?
Yeah, I think patient in terms of selecting a home care professional, they must sort of evaluate that how professional these people are. I think it's very important that they are keeping only the well-trained manpower. Now, like you know how it works in some of the nursing homes and all. Untrained people are doing a lot of work. I I think you must have read in the paper today. The hospital in UP has been closed. Why? Because somebody who was doing commerce, he operated on the patient. Today in the newspaper. Yes. So you can see. So home care companies have to keep a well-trained professionals. Not only well-trained, but their training should be constant. They should be constantly upgraded in terms of training. And I think that's very important.
how,
That you have to,
how to establish that? Is there some kind of a certification or something, or some kind of a specific training which they say that, okay, like you see that as ISO 2001 certified, or some, is there something like that which kind of, or for hospital we have NABH accreditation, so that kind of give you assurance of a certain level of quality. So is there something similar for?
yeah, that's right. It has happened. That's what I'm telling you. In Australia, the CEO of a company had come here. He gave a nice, beautiful lecture, and he says how at every level they have solved the problems, maintained the various SOPs for everybody, right from the SOP for the director to the doctor, peripheral doctor, the main doctor, how they are able to coordinate all this. So there they have got, of course, the facilities that if there is an emergency, rarely says we are not found emergency. At home, they can get the ambulance in 2 minutes. So the ambulance person knows where you are going, and he closely keep a watch. The moment he gets something, he'll make sure the ambulance nearby reaches over there. So they everybody is thinking, and applying it, implementing it. So I think it's a question of time. India, it will also come. Everything has come in India. So these things will have to come.
So I think you are saying that apart from the training and the other, kind of academic aspect of it, companies should also be well equipped with the technologies which they deploy
Absolutely.
to kind of have the right kind of constant monitoring, alert systems, and so make sure that any kind of intervention can be brought in at time. Uh, that's wonderful to know, Dr. Advani. One more question, which I'm trying to understand, that what is the time when that the patient should definitely, or the family should definitely seek help of doctor and take the patient to the hospital, and do not fear about COVID-19 anymore, because in the fear of something unknown, something which is known to them can cause a bigger damage.
No, I think both doctors and I'm telling you, patients also. Patients, their relatives are very clear because they can judge what can be done at home, what cannot be done at home. They are also very clear. They have seen the daycare, how the facilities are there. Those facilities you cannot create completely at home. But in a case where they feel that they went to the daycare, but it looked very simple. I mean, it was so simple. So you say, why can't we implement that at home? So I think even today, patients are coming to the hospital. It's not that everybody is not coming, but they do come and inquire that how you can, doctor, how you can help me to do it at home so that my apprehension, patient's apprehension, and the relative's apprehension is reduced. So I think it's both way. We also explain to them that look, this is not possible at home, and we will not advise you to take at home. Some which is possible safely, we'll say fine, you can take it at home. So I think everybody should be clear about what to do safely and effectively.
Thank you. So, Dr. Advani, we were, kind of asking most of the question which we had received from, kind of various audience during the promotion of it. But we are also getting some of the live questions. So, I would like to spend the last 5 minutes of our conversation to try to address those questions. And there is one question which has come up, that what are the potential risks? We have talked about, I think, all the positive aspects of home-based cancer care. So, our audience has asked about that. What are the potential risks of home treatment for cancer patients during COVID-19? And I think that will also help people to be a little more careful to avoid them.
Yeah, I think the important thing is that how the home care people sort of look after the patient and satisfy them. I think it's important. Right from the moment they enter the home, they have to show to the everybody around them that they are taking utmost care, or they have taken utmost care to make sure that nobody in the family or at home will be affected. They have to show that. They have to sort of prove that. It's not by just saying. So the way you should dress and take care, I think is important. Similarly, the home care also, first when they go, they talk to the patients and the relatives, and they tell them that what they are going to do, how they are going to do, and how this whole thing will be done. Apart from that, whatever is you know used, those things are all collected. They are not just left at home. They are collected and put into the proper disposable way, and bringing them back to such facility. So I think the home care, everybody understand, right from the physician in charge, he also has to understand what is home care. Then the home care people themselves, then the patients and the relatives, all Everybody has to have a sort of agreement on the way it works, and then only it will be success.
Thank you. So that means even if you are going for home care, do consult and do it under the close supervision of your, I think, doctor. That is the one thing which I can help reducing most of the risks. And do your diligence in terms of the training and the technologies and the processes your healthcare providers follow at home. Doctor, there is a specific question, Dr. Advani. Is a plastic anemia is curable?
Oh, yeah, aplastic anemia is divided into many types. One is mild, one is moderate, and one is severe. Mild and moderate, they usually recover. Severe aplastic anemia normally requires the active treatment, either in the form of bone marrow transplantation or in the form of a treatment, we call it ATG. So I think it is a treatment which is possible, and but the most important thing is prevention of aplastic anemia. People don't realize that aplastic anemia can be prevented. But why does the aplastic anemia occur? It occurs because of the some of the tablets. Many almost 50% of aplastic anemia are related to some tablets which the patient has taken. Some people take lot of painkillers and all, and they can cause the severe aplastic anemia. So prevention is the most important thing, and then comes the treatment depending upon the severity.
Thank you. I think that would have addressed the question from our audience. There's another question about how to improve immunity in chronic lymphocytic leukemia. Uh, what is
Hmm.
your tips for that? Do they?
Yeah, I think what we advise them, first thing is at the time of diagnosis, we give them some vaccines, like vaccines for influenza, vaccine for pneumococcal pneumonia. All these are given. So that is one way of preventing infection. Second thing is we measure their gamma globulin, immunoglobulin. And there are people in chronic lymphatic leukemia who have a very low level of gamma globulin. And then we have to give them the gamma globulin every month for lifelong in some of these patients to prevent the infection. Luckily, recurrent infection don't occur in majority of chronic lymphatic leukemia, and therefore ultimately it's only very few who need such type of the treatment.
Thank you so much. I think we are kind of spilling over from our designated time because there are some lot of questions coming in. But I just take one question before we kind of conclude it. And this is interesting question actually because one of our audience has asked that how do you see that how much hospitals are ready to promote home care management or provide home care management, especially given the time that most of the hospital these days are kind of feeling or claiming that there is a dramatic dip in the OPD footfall. So is there a time that the hospital should stretch themselves and go into the home care services? Do you see that as a possibility?
I think that will definitely come. It has already come in few hospitals where I know that nursing staff have been trained in the at least in particular area. Like they say, 10 kilometers around the hospital. They are able to send their personnel. They regularly go and give them like dressing is to be done, some IV fluids, hydration is to be done. All these procedures are being done. So I think they are creating their own home care units, and I think that's a step forward. And I think most of the hospitals will come up with that.
And that may also give more assurance maybe to the patients that the kind of services will remain seamless in that case.
Yes.
But thank you so much, Dr. Advani. Wonderful interacting with you. If
Yeah.
you may like to give a couple of tips to the public in general, as a healthcare veteran, uh, what they should be doing during this COVID-19 time.
Yeah, I think most important thing is follow the WHO guidelines or COVID-19. I think that will do. That's the only way. I strongly believe that if all of us keep a 6 feet distance from each other for 1 month, everybody, the COVID-19 will disappear. Cannot survive outside. It just cannot survive. They have to go into the body to survive. So they cannot survive on tables or on the any of these things. That RNA virus is so sensitive. So I think ultimately follow the WHO guidelines. There should be no problem at all. Particularly when you are going to the hospitals, make sure that not 10 people should go to the hospital. That's a normal Indian tendency, where one patient comes with 6 other members of the family who are very much bothered about the patient. But I think that should be avoided. And majority of the hospitals today don't allow more than one attendant to come inside the hospital campus. So I think at the level of the public, these things are very essential that they also should participate in preventing the COVID-19 for the benefit of everybody. Thank you.
Thank you so much, Dr. Advani. So here we, conclude, and it was wonderful interacting with you. And we got so many questions, and we got also, the wonderful answers from your side.
Yes.
So here was Dr. Suresh Advani answering your questions on cancer care, prevention, and especially home-based care for cancer during COVID-19. If you have more questions, you can send them to us through WhatsApp. To use, click on the WhatsApp button of on our page. Also, don't forget to follow us to stay updated on all that concerns your health and well-being. This program was supported by Silpa Medicare Limited under their public awareness initiative, and we will be back with our another special show on cancer prevention and care during COVID-19 next week, same time. So keep sending your questions, and we will certainly include them in our next show. Till then, stay at home, as Dr. Advani said, eat healthy, sleep well, keep giving your mind and soul a daily dose of positive thinking. And don't forget to maintain personal hygiene, social distancing to protect yourself and your loved ones from coronavirus. So goodbye and see you soon.